Good morning. Thank you for joining us. My name is Amy Feather, and I'm the Executive Director at the Kensington Falls Church. Before we get started this morning, I'd like to walk through just a few housekeeping rules. We're using a Zoom webinar this morning, so you'll notice that your microphone button and your video button will remain inactive throughout the entire event. But we would like this to be an interactive event, so we want to be sure we capture all of your questions. Please use the little Q&A button there at the bottom of your screen to send us any questions you might have. And don't worry about missing anything. We're going to be recording the event today, and we'll be sure to send that out to you early next week. Again, thank you for joining us, and I'm going to hand the screen over to Susan Garvey. Susan?
Thank you, Amy. Hi, my name is Susan Garvey, and I'm the Director of Community Outreach for the new Kensington Reston Assisted Living and Memory Care that is opening in March of 2021. On behalf of the Kensington Falls Church and the Kensington Reston, we're very excited to have John Norce, founder and president of MEDICAREPORTAL, as our guest speaker this morning. For over 31 years, John has helped thousands of clients in health insurance and Medicare. Whether you're new to Medicare or currently receiving Medicare benefits, I know we will all learn a lot this morning listening to John's presentation. John's extensive knowledge of Medicare uniquely qualifies him to be a certified continuing education instructor. John integrates a team approach with his clients to simplify the complexities of Medicare by assisting seniors in making informed decisions regarding their Medicare benefits. John is very involved in his profession as an active participant in the National Association of Health Underwriters, where he is the past president of the Northern Virginia chapter, and the National Association of Insurance and Financial Advisors, where he is currently the treasurer of his local chapter. In addition, John finds time to give back to his community. This year, John celebrates his 15th year as a wish granter for the Make-A-Wish Foundation. And this fall marks his 33rd season of coaching youth sports in Northern Virginia. Without further ado, I will mute myself and turn it over to John.
Thanks, Susan. Thanks to everybody for joining us today. We're going to keep this casual. We'll keep it moving. I don't think I'll be at too quick a pace, but we will move quickly. But if you have questions, obviously, please send them through the chat or the Q&A, and we'll respond to them. I will take periodic breaks to answer those questions and address them. So without further ado, we'll get started. So I like humor. So when you think of Medicare, if you've either been on Medicare or you're going to be new to Medicare, if you're not confused, you're not paying attention. For those that are familiar with Medicare, you know that it is a very complex medical care product. So what is Medicare? Medicare is a federal program. It's going to offer health insurance to American citizens and other eligible individuals. It was created in 1965, but actually enacted in 1966. So this year celebrates the 54th year of Medicare. Today, we're going to speak about all aspects of Medicare, but for terminology that I think will help you understand it better, in 1966, what was enacted is Original Medicare, which is comprised of two parts, Parts A and B. So when I talk about Original Medicare throughout the presentation, just try to remember that I'll be talking or referencing Parts A and B. Part C, which we'll talk about today, which is Medicare Advantage, that was enacted in 1997. And then Part D was enacted in 2006. We will cover all aspects of Medicare today, including what's called Medicare Supplement. So quickly, who is eligible? Many of you on this webinar may already have Medicare. For those of us that are new to Medicare or may be new in the next coming months or years, the requirements are very simple. You must be a U.S. citizen or legal resident. You must reside in the U.S. for at least 5 consecutive years prior to applying for Medicare. There are special exceptions to Medicare, not just being over 65, But if you're under 65 with a qualifying disability, and then for those that are unfortunately diagnosed with end-stage renal disease or Lou Gehrig's, they would have basically immediate access to the program. So I show this slide in the early parts of my presentation because I try to simplify Medicare and help you understand that there really are just two roads for the majority of us to go down when seeking to solve or take care of our medical care under the Medicare program. So the red boxes are on the left. That would be an individual that decides to take original Medicare, again, that A and B benefit, and make that the primary payer of claims. Under that solve, Medicare would be the first payer of claims, and all you would make sure you need to do is to find a provider that accepts Medicare. So anywhere in the country, whether you're in the DC metro area, you're a snowbird in Florida, you have family in California, wherever you are, and you need care at that moment, all you need to do is seek out a provider that accepts Medicare.
Excuse me, John.
Yep.
This is Susan. I just want to let you know your slides are not showing.
Oh.
Okay, so.
Let me try again. Hold on.
Okay.
Thank you so much. Are we better? Can you see him now?
Yes, we're
Yes,
good.
John, that's great.
I'm so sorry,
Thank
guys.
you.
I don't know what
That's
happened.
okay. That's all right.
So just to take a step back then. So the left boxes under the red, option 1, is the original Medicare that I was referencing to. And I'm terribly sorry about that. The Medicare supplement would be a product that you would purchase to cover some of the gaps of Medicare. So that's why it would be called oftentimes Medigap or Medicare supplement, same product, different name. And we'll talk about that in a second, but basically you would purchase that product to pay secondary after Medicare pays. And then the third part of that solution or solve for your Medicare benefits is Part D, the drug plan. So under that option, you would have full Medicare benefits. How we like to explain it to help you understand it a little better is you would have 3 ID cards: your red, white, and blue Medicare card, a Medigap card, and then a Part D card. On the right-hand side in the blue box is what's called Medicare Advantage. Many of us may have a Medicare Advantage plan, many or know someone who does, or you'll see on TV, or maybe you've attended a local seminar or webinar that explains the product to you. Medicare Advantage is run by private insurance companies. So unlike original Medicare, which is a government-run program, this is run by private insurance companies. And under this Plan C or Medicare Advantage, all your benefits that I just discussed, your A, B, and D, are all provided under this one plan. So again, to simplify it, now you go from 3 cards to 1 card. So you have 1 card that will coordinate all your care. To go back to a fundamental difference between these 2 programs is that Medicare Advantage will oftentimes have a network to access care. So if you are looking for primary care doctors or specialists in your area, you may be restricted to a network of providers. That's under an HMO or managed care typical design of your policy. Today, more and more companies are offering what's called a PPO option, preferred provider organization, which some of us may be familiar with, where you can go to outside providers of the network. The only downside would be you would pay more for those services. But again, the product is starting to look more and more like original Medicare. Just for compliance reasons, I am not advocating or soliciting any that one is better or worse than the other. I'm just covering the advantages or the differences between these 2 plans. So this is kind of it's a busy slide, I understand it, but it will give you a graphic of understanding what is actually covered under original Medicare. So Part A is going to be your hospitalization. And I like to tell people to think of a building when thinking about Part A, because all of your care will typically take place in a building: a hospital, an inpatient hospital, skilled nursing, some form of rehabilitation or nursing home, home health care, and then ultimately hospice. Now, hospice isn't necessarily tied to a facility, but we all understand that hospice is a covered benefit under Medicare Part A. For most of us, Part A will be free. We won't pay for it. Either you or your spouse has worked 10 years or 40 quarters, similar to the criteria that qualifies you for Social Security, and you would be able to enroll in Part A at no cost. Part B is going to cover just covered in Part A. So very extensive benefits. Doctor visits, outpatient surgical procedures, unlike the inpatient, the outpatient, labs, x-rays, MRIs, CAT scans, durable medical equipment. One part that is confusing oftentimes, if you are in an inpatient hospital stay and receive the services of a doctor, the doctor would be still billed under Part B as in boy. So just one of those things that sometimes people don't understand because they assume a building of a hospital would cover all their charges, probably like their health insurance had historically. And then, as I mentioned, Part D would be a drug plan. This would cover your self-administered drugs, anything that you orally ingest on a daily or weekly or monthly basis. This would cover those plans. These are going to be also sponsored or offered through private insurance companies, and they will offer retail and mail order depending on how you decide to receive your medications. So under an original Medicare solve, again, this would be 2 of the ID cards to make it simple, the red, white, and blue card, and a prescription drug plan. The third part or component of this that I'll cover now is going to be your Medigap or Medicare supplement. So in order to get a Medicare supplement, you have to have parts A and B. There is no avoiding parts A and B to get a Medigap. The reason being it's going to pay secondary to all your Medicare benefits. So when a claim goes through Medicare, it will, and you have a supplement, Medicare would forward that claim to your insurance company, who would pay as the secondary payer. So what does it cover? It's going to cover things like deductibles, co-payments, and co-insurance that actually exist inside of Medicare. So for example, Medicare Part A in 2020, if you were hospitalized from 1 to 60 days, under Part A, there's a $1,408 deductible for that stay. Your Medigap would pay 100% of that cost. Under Part B, there's a $198 deductible for 2020. We all know a deductible, we would have to pay the first dollars. However, after achieving that $198, from that point forward, 80% of your claim would be paid by Medicare, and the 20% approximate balance would be paid by your Medigap. It's important to understand that if you are shopping for a Medigap plan or you're on a Medigap plan, that all the plans are what are called standardized. What we mean by that is, for those that may understand the differences in the letters, a plan F is a plan F, a plan G is a plan G, and a plan N is a plan N. Does not matter what company you purchase it from. If you're interested in a plan F or a plan G or a plan N, it will be the same exact medical benefits across the board. So one, quote unquote, isn't better than the other. They're all standardized. And this obviously does require a monthly premium to purchase a Medigap plan. Those plans will be based on your age, gender, your residence. Oftentimes, if you smoke, we'll talk about guaranteed enrollment or guaranteed issue of this product because it is outside technically Medicare for conversation purposes as well as educational purposes. Medicare, as far as the federal government program goes, is parts A, B, C, and D. Medigap is technically not part of the actual medical or government program. What I'll do there is I'll cover part C here for a minute, and then we'll take a break and address any questions. So part C, as I mentioned, is this all-inclusive Medicare benefit that's administered or offered through a private insurance company. So without repeating myself, though, you'll see here it includes Part A, same benefits, Part B, same benefits, and Part D, same benefits. Where Medicare Advantage differs from original Medicare is Medicare Advantage providers will often offer you, as a beneficiary enrolled in their plan, dental, vision, hearing, gym memberships, transportation to and from medical providers. That's not ambulatory. That would be actual just arranged or elective procedures and things that would be needed to be taken care of. Checkups, physicals, even a trip to the pharmacy if you couldn't acquire your medications through mail order for some reason. They'll offer a 24-hour nurse line, and then what's called an OTC or over-the-counter benefits. The goal here of Medicare Advantage, where it differs again from original Medicare, is that these are private insurance companies that are interested in, again, that concept of managed care. So they know that if you obviously maintain good oral health, that you will potentially prevent other related illnesses that could be born out of poor dental health. They know that vision is obviously important as we age. If we can't see, We may create accidents and things that would hospitalize us. Hearing is important. Obviously, hearing is important not just to hear, but for balance and such. Gym memberships, obviously keeping people healthy or active. Now, clearly during COVID, that probably wouldn't be a good idea, but they are available. And obviously the value of transportation, being able to get to providers. Another enhancement that's happened in the last year with the COVID pandemic is not only just original Medicare, but Medicare Advantage plans have put telemedicine at the forefront. And that's also another excellent benefit that you get from both, but is again a strong benefit here from a Medicare Advantage program. So I'm going to take a break here for a second. Do we have any questions that I can address right now?
Yes, we do, John. The question is, where are annual physicals covered?
So thank you for that question. Any kind of doctor care will be covered under Part B as in boy. So if you are an original Medicare, that would be billed under Part B. And again, if you have Medicare Advantage, that would just be tied to your company and that would be covered. So that's an excellent question.
That's it for now.
Okay. Well, if people come up with others, please pop them into the Q&A or just stop me if it's relevant and I'll answer it at the time. So the next phase, now that we've covered Medicare, the basics, A, B, C, D, and a Medigap plan. Obviously, we want to understand, well, when do I need to enroll or how do I enroll? And we're going to go over that here in this next segment. So the initial enrollment period, or IEP, is for everyone when they turn 65. No matter what your situation is as far as health insurance goes, at 65, you have the opportunity to enroll in Medicare. Again, assuming you've met the A and B criteria. So assuming that you have, your IEP is 7 months surrounding your 65th birth month. So I'm a September baby. The months of June, July, and August, I can enroll and get my A and B card on, well, technically before, and I would start on September 1st, my Medicare benefits. That is important because if I have any other type of health insurance that might end when I turn 65, by applying early, my health insurance would expire on August 31st, and my Medicare would start on September 1st, and I would have no gaps or breaks in my health care. As we age, obviously, it's extremely important to make sure we don't have 1 minute without health care. So starting early and enrolling in your Medicare Part A and B will help you start on time. It's important to understand, if I were to be lazy or out of the country and just not addressing my Medicare, that if I applied in the month of September, I wouldn't start till October 1st. Well, why is that important? Well, even though Part A would go retro back to September 1st, I can go into details another time, but just take my word for it. My Part B wouldn't start till October 1st. Well, I need A and B to either get Plan C or a Medigap. So technically for the month of September, I only had coverage if I went in a hospital, skilled nursing, rehab. And again, that's only as a primary payer. So it's a scary proposition if I were to miss my initial enrollment period's birth month and have to wait. It gets worse if I miss the month of September and I wait till October. If I decided to apply in October, I would not start my Medicare Part B till December. So I would have gone all of September, all of October, and all of November, basically with a hospital plan. Now, with Part A, I could get Part D as in drug, so I would be able to, in a sense, get some kind of benefits. But my overwhelming type of care that I would seek through Part B, I have no benefits. And then if you wait, in my situation, till November or December, it would be a 3-month delay. It's an extremely scary proposition when, again, you think of the importance of our health care. During the IEP, you can enroll in any plan without any medical underwriting, any pre-existing condition exclusions. You are coming here no matter how you arrive, as pristine or clean as possible to get any of those benefits. The important one is a Medigap or Medicare supplement. You're offered typically a 6-month window from your birth month to acquire a Medicare supplement with no medical underwriting. Should you miss that 6-month window for whatever reason, you could face medical underwriting and be denied a Medigap policy. Well, why is that important? Well, if you were going to be intent on taking your benefits through Medicare A and B, that would be great. But without a Medigap, you would be exposed to all those 20% charges without a cap on your benefit. So that could become an expensive proposition. So it's important to understand, again, when to enroll and to enroll on time. Again, IEP, turning 65. For those that want help with it, we actually, on our website, MEDICAREPORTAL.org, our website is a fully educational website. Just so you understand, there's no solicitation. You won't be spammed or anything. We have an IEP calculator. So if you go on our website, find the IEP calculator and put in your date of birth, we will tell you when your IEP starts and when it ends. And again, if you have any questions on that after this, we would be more than willing to help answer those.
We have some good questions right now.
Go ahead.
Okay, we have a few. So the first one is, when someone is eligible for Medicare, but still has minor children, what are the best options for covering them?
Yeah, so for time's sake, Susan, and the complexity of it, that would be something that I would rather address on an individual basis, because depending on their circumstances, there's a lot of moving parts there.
Fair enough. So I will type that back. Would a husband and wife enroll separately if both are eligible?
Yeah, so great question. And we get to that, but I'll address it here. So Medicare is unlike health insurance. So for conversation's sake, if Susan and I were married, we could be through the employer plan on her company or my company, and we would again receive the same health insurance depending on whose company we decide to go to. On Medicare, it's an individual product. When you actually enroll in Medicare A, B, or A and B, you get a red, white, and blue card with what's called a beneficiary ID. Much like your social security number, that is your unique identifier. So when you are deciding to enroll in Medicare, it's completely separate of your spouse. Now, we're going to talk about in a minute the financial costs of Medicare, and you'll see how those are, in a sense, tied together or potentially tied together. But for enrollment purposes, you are considered an individual for Medicare. That's an excellent question, and thanks for raising that. Any other questions, Susan?
Yes. If I plan to keep working until age 70, is there any need for me to enroll in Medicare? I'm 65 now, and I have health benefits through work.
Yeah, great question. So if they can wait 5 minutes, we'll be there.
Okay, great.
No, we absolutely cover that because it's a common question. So if they can wait 5 minutes, we will absolutely cover it. And if I don't cover it, please ask your question again. Not a problem.
All right, you can move on.
Yep. So Medicare is a very rigid program. And if you do not enroll during your initial enrollment period, meaning that you do not have employer coverage, which we'll discuss in a second, and you miss, for whatever reason, your application or opportunity in the IEP to apply for parts B and D, you will face a lifetime penalty. I did not make a mistake. You will face a lifetime penalty. So if under my example where I'm a September baby, if for some reason I didn't enroll between my 65th birthday and the next year, just 12 months later, I would face a 10% penalty of the Part B premium added on to my Part B premium for the rest of my life. And if I went 24 months without enrolling in Part B, from when the government deemed I was first eligible, which is September of my 65th birthday, I would pay 20%, and 3 years, 30%, and 4 years, 40%, and 50%. This is a very, very cruel and evil penalty for someone that may or may not know the rules of Medicare. We'll talk about working past 65, which sometimes does create this confusion here, but understand that if your IEP is coming up, that you get the answers as it relates to you and only you and your addressing of Part B as in boy. I will address Part A in the next section of working past 65, but for most of us, you can get Part A at 65 without really thinking about anything, because Part A is free. It would be a secondary payer if we're still working. It would be a primary payer if we have to go on Medicare, but there's no penalties to enroll or not to enroll in Medicare Part A. So Part B is something that really all the action or decision-making is around when you're deciding in IEP whether you need to go on Medicare Part B or not. Now, along those same lines, Part D, the drug plan, whether you address it through a standalone Part D using original Medicare or under Plan C or Part C Medicare Advantage, if you fail to enroll in Part D, again, during that initial enrollment period, the federal government will penalize you 1% per month for every month that you went without coverage. So again, using my example of September, if I waited a year, they would actually tell me that I couldn't enroll until October of next year to start January of 2022. Simple math, I can tell you that's a 16% penalty. That 16% would be applied to the average Part D premium in the country, which for this year is $31. Rounding for pennies, I would pay $5 a month every month for the rest of my life penalty for Part D. Plus, I would have to pay my Part D premium. And then as you'll see in a second, there's also what's called an income adjustment for Part D. So you could potentially put yourself where you're paying more for Part B and D if you fail to enroll when you are considered first eligible. So I'm going to stop there for a second. Susan, did we raise any questions on this?
Okay, let me take a look here, John, because we have 3 questions. What is an IEP?
That's initial enrollment period. That's the 7 months that surrounds your 65th birthday. That's the Medicare term for that window, initial enrollment period.
We get a lot of information through the mail. How can we figure out what is legitimate and what's junk or scam?
Well, I think the number one thing on what is legitimate is that something that you can confirm comes from the federal government. And that will not be any form of solicitation or requesting you to call into a phone number or discuss benefits. SSA, Social Security Administration, CMS, Centers for Medicare and Medicaid Services, it will be pretty clear that your communications from them are typically in white envelopes, and they're going to have their logo and look obviously official. I can't comment on, obviously there's fraud that exists in the Medicare world, unfortunately, how to filter through that. What I can tell you is working with someone like us who are local, we are certified insurance agents. We have a track record of obviously being compliant and doing things on a compliant basis, not only with Medicare, but as an insurance agent, you know, holding ourselves to the highest standards of ethics and morals. We don't charge anything for our services. So engaging with us to just filter through a lot of that noise, we're more than glad to assist you. And should you enroll in a product with a Medicare supplement, a prescription plan, or a Part D, we are compensated by an insurance company, and it has no impact on your premiums. So again, I'm not trying to sell that you have to use our firm, because there might be others out there that are credible, but I can only speak for our services and what we do, and we can help you obviously answer those questions.
And lastly, can you explain the donut hole?
Yeah, let me defer that for
Okay.
just because it's kind of lengthy, and I'd rather get through this part of the and then I can address that, no question. So if you
Very
could
good.
do that, I would appreciate that.
Okay.
Thanks, Susan. So also like to cover in our presentation, just briefly, the finances of Medicare. As I alluded to earlier, there are deductibles, copays, coinsurance, and other aspects of actual Medicare. And if you go on Medicare Advantage, your plan will typically have copays, coinsurance, max out-of-pockets, other moving parts. There are so many plans, and then for compliance reasons, I can't discuss specific plans on an educational event like this, but understand those are certain aspects of your out-of-pocket expenses. What I'm going to address here, which is very important for people to understand, are the premiums that you will pay to the federal government for your Medicare. So Part B carries a premium. So if you are interested in enrolling in Part B, you need to pay a premium every month to the federal government. So your Part B premium can be paid out of Social Security. You can pay a paper check. They can set it up out of your bank draft. But at the end of the day, they will want their money every month. Your Part B premium since 2011 under the Affordable Care Act was adjusted due to your income. So the title of this, the Income Related Monthly Adjustment Amount, or IRMA, is what determines what you and your spouse, if you file jointly, will pay for your Medicare benefits. So I, as a single person, if I made less than $87,000 in 2018, they look at a 2-year look back. So 2020, 2 years ago is 2018, and I made $50,000 line item across. I would pay $144.60 per month for this year for my Medicare Part B, and that would go to the federal government. If in 2018, I actually made $100,000, I would pay $202.40. And again, if I made $125,000, I would pay $289.20. And simply, if I was married, you go to the column there, married, joint, and MAGI, for those that aren't accountants, which most probably aren't, that's called your modified adjusted gross income. That's a number that's slightly above your adjusted gross income because they add back some of your deductions. But I'm not an accountant. We're not going to give tax advice here, but understand that that number is what determines these criteria. So if I was married and we made $250,000, I would go to that line item. Myself and my spouse would pay $289.20. Now that number will adjust every year based on the 2-year look back, as well as either increases or decreases in the Medicare Part B base premium. So last year it was $135.50. This year it's $144.60. We're seeing projections next year of $148.50. Again, don't take that to be super accurate. We'll know that number next month in November, but understand there is a trend in that is going up. And therefore, if the base premium goes up, all the IRMA adjustments will go up. Now, for time, I just want to point out that Part D, the drug plan, also uses the same income chart to determine a Part D premium. Where that differs, however, is Part D, you would have a payment to the federal government for your IRMA charge, and you would also then have a Part D payment either to a standalone prescription drug plan, or if you had a premium associated with your Part C Medicare Advantage. Enrolling in either Medicare Advantage or Original Medicare or buying a supplement will not get you out of a Part B IRMA adjustment and then potentially a Part D IRMA adjustment. For just the conversation and for time, if I made $100,000 under 2 years ago in 2018, my Part D add-on would be $10.60. And the highest level there is $76.50 if I made over $500,000. So while it's a lower payment, it still is an additional payment that you would be responsible to take to pay Medicare in order to receive your Part B and D payments. So I'll stop there for a second. Susan, any questions on this?
Let's see. Should I apply for Medicare if my wife is not yet retired and we are still on her health benefits from work?
Yep. The next area we get into that.
Okay, great. So just the donut hole and we're not there yet. So we're good to go.
Yep. We're moving. We're smoking.
We're moving.
All right. Ta-da! So working past 65, which we always get questions, and I appreciate those that already have addressed it. So I will address the variables around turning 65 and working past 65. And again, if you have more questions, please ask. So working past 65, we know more and more people are doing it. I think it's great that people want to stay in their careers longer if they're enjoying it. Unfortunately, we cannot make the decision whether to stay on health plans at our employer or go on Medicare. What do I mean by that? The federal government has clear guidelines, and it's right next to my #1 tab, that based on your employer size, that will be the first criteria of whether you can remain on employer health insurance or you have to enroll in Medicare. If your employer has 20 or less employees, so I run a small, obviously, Medicare business here, and for conversation's sake, I have 5 employees, I would have to go on Medicare A and B at 65, and that would become my primary payer of claims. I'll repeat that. By being under 20 employees, Medicare enrollment under my IEP, which we covered earlier, would be required because Medicare would become my primary payer of insurance really for the rest of my working life. Under that scenario, it would be up to me to acquire either Medigap plan, a Part D plan, a Medicare Advantage plan, or potentially discuss with my current health insurance provider, could they be my secondary payer of claims? Again, there's a lot of variables around that, but what's most important that you take away from the last minute of conversation is that if your employer is under 20 employees, that under IEP, you will be enrolling in Medicare A and B. For those that are self-employed, independent contractors, you also will have to enroll in Medicare if you're under 20 employees because you're one person under your IEP. If you work for a large corporation, or government, anyone that has over 20 employees, you may delay your enrollment into parts A and B because your coverage is what's considered, this is the key word, creditable. So if you go down to number 3 there, it's going to say by maintaining creditable coverage, you will qualify for a Medicare Parts B, D under a special enrollment period, which will allow you to enroll in the future with no penalties. I'm going to repeat some of this again so it's clear. Government, Medicare, CMS determines that if your employer is over 20, that your coverage meets or exceeds Medicare standards. By virtue of it meeting or exceeding Medicare standards, they will allow you to delay your enrollment into B and D under what's called a special enrollment period. So I at 65 do not have to enroll in B, D, A, or anything else if I don't choose to. There's nothing that will force me to enroll in any parts of Medicare because my health insurance through my employer will be considered primary. So for those that, whether you work for the federal government, a large employer here in the area, at 65, technically you're still working. You don't have to do anything. Now, we will address a couple things here that will be helpful tips. If you are turning 65, working for a large employer and funding an HSA, a health savings account, and only an HSA, not HRA or FSA, you cannot have any parts of Medicare and continue to fund the HSA. Again, I'm not a tax accountant. I'm not giving tax advice. I am giving you the actual compliance, and that is that, again, if you turn 65 and determine that you want to continue to fund an HSA, you would want no parts of Medicare. For everyone else, you would probably take Part A because it's free. You're not going to pay a premium. We call it premium free for Part A. And Part A would be a secondary payer to your health insurance. So if an individual was 66 years old, had a situation where they went in the hospital for a medical procedure, their health insurance would be billed first, and then that bill would be sent to Medicare Part A to be a secondary payer. You do not need Part B because Part B would duplicate under that scenario your health insurance. So we would have Part A as a secondary and health insurance as a primary. Now, also a very important aspect of working past 65, and it may be just convenient for the timing, but many of those on this webinar may have received a letter from their employer's health insurance company that says for 2021, your Part D benefits are considered creditable. That's a very important letter. Should that letter ever tell you that your benefits are not creditable, you would be, in a sense, forced to enroll in a Part D plan to address those benefits. And should you not, you would face that 1% penalty again. If you're not sure about that letter or you're not sure about your coverage, contact your HR department or your spouse's HR department, wherever you're receiving benefits from, and you can get that information on creditable coverage. Now, also along the lines of the same thing here, if I was working and my wife was working and I had health insurance at my company and she had health insurance at her company, but my company only had those 5 employees, I could say, I'm not going to enroll in Medicare. Her big company, I'll just move my health insurance from my small company to her big company. I'll be her spouse. I'll get only Part A, and I'll continue to delay my enrollment in Part B and D. Let's say in 5 years, my wife decides to retire, then both her and I would have to enroll in Medicare because we would have no other employer health insurance to have as an alternative to Medicare. Lastly, a very important point that unfortunately we have a lot of consultations that come to us these days because with this pandemic, people are losing their jobs. It's tragic. But COBRA is going to be offered from a large employer to provide healthcare benefits. It's extremely important you understand this next segment if you either are on COBRA or potentially going to be offered COBRA. After age 65, COBRA is not considered creditable. What do I mean by that? While your employer is still providing the quote health insurance through a COBRA administrator, the federal government does not see COBRA as a primary payer of claims. They only see COBRA as a secondary payer of claims. So if you are going to be on COBRA, say starting November 1st, and you said, I'm good because my employer is going to pay for 6 months of COBRA, unfortunately, you are in a very bad situation because your Medicare Part A, assuming you had it, would be a primary payer and your COBRA would be a secondary payer. So in that situation, you would be good. The problem is if you think COBRA is going to pay as the primary payer and fail to enroll in Part B, you would have no Part B primary benefits. You would only have secondary Part B benefits through COBRA, and you would now become an insurance company and be responsible for 80% of those claims. This is a federal law. This is not something that we make up. So it is extremely important if you're on COBRA or being offered COBRA that you make sure you address your Medicare benefits immediately, and that is surrounding your Parts A and B benefits. Now, again, if you already have A and B and are offered COBRA, you are fine because COBRA will provide that secondary payer for A and B, and as well as D. But if you do not have B and you're offered COBRA, you should go out and acquire B right away. I will stop there, Susan, because I know we had questions around this, and I will be more than willing to answer any of those questions.
Okay, so the next question is, do I have to pay both monthly premium and the IRMA?
No, so for Part B, it's one payment. So if you made that 200,000 as an individual, or 100,000 as an individual, and it was the 20240, you would only be responsible for the 20240. That is the aggregate of the 144 plus the $57 adjustment. That's your Part B in its entirety. Under Part D, drug, you would pay the IRMA to the federal government, but you would pay a premium for your actual Part D benefits to an insurance company. So you would have two parts for Part D potentially, where for Part B, you only have the one payment to the federal government. That's an excellent question.
And that's it for now, except for the donut hole.
Yep.
Okay.
So this is just a quick visual of how the special enrollment period works. So just to rehash that, I'm working past 65. I've had that creditable coverage under the employer, large employer. From the time I leave the employer plan, the last day of benefits, I have 8 months to address my A, B, and Medigap. So let me rephrase that. So if I had no AB at all and I retired on September 30th, I would have 8 months to get AB Medigap. Now, I need A and B to get Medigap, and I might potentially have already had A, so maybe I only have to get B. But the point is you have an 8-month window to address that. Now, remember, if you don't have other insurance through a spouse or some other kind of retirement program, you are now what we call naked, and that if you don't have A and B, you can't get Medigap. So you really only have that catastrophic Part A hospital coverage. The crazy part about Medicare, and this is why we try to help people understand it, is that while you have 8 months to get A and B, you only have 63 days to address your prescription drug coverage under Part D and Part C Medicare Advantage. Well, you need Parts A and B to get a Medicare Advantage Part C. So should you have waited 3 months from September to get your Part B, you would be unable to get a Plan C, and you would get unable to get a Part D plan, and now you would be calculating that 1% penalty for failure to enroll within that 63-day loss of Part D benefits. So 8 months for A, B, and Medigap, 63 days for C and D. Again, important to emphasize that 8-month window for Medigap, would allow you to enroll with any pre-existing conditions, and whatever your health is irrelevant. They cannot penalize you, deny you during that 8-month window. Should you wait beyond that 8-month window, you would be subject to medical underwriting and you could be denied enrollment into that program. To kind of summarize a lot of what we've covered today, make sure you know your IEP date and enroll on time. Medicare will automatically enroll you in Part A and B if you are on Social Security benefits. I want to stop there real quick. So now that we're closing down, or I'll address the donut hole, but other questions may come in. But understand at 65, that IEP, you have to take a proactive part in getting Part A and B, as I indicated. Should you be on Social Security or railroad benefits, you will be automatically enrolled in A and B to start on the first day of your 65th birth month. And that card would be sent to you 3 months prior to your 65th birthday. Now we stop here, and again, we can help people with this, but under COVID, you can no longer go into an SSA office voluntarily. I'm told you can make appointments. I don't know anybody who has, but enrollment into A and B, if you need to do it, you can do it at 65 over the phone by making an appointment, through the mail by sending in what's called your 40B, or online through an SSA.gov account. If you've worked past 65, you have to do it a different method, because you're required to get what's called the CMS L564, which is your employment form that verifies your creditable coverage since you turned 65. The only way you can do that is through the mail, through a website secured through SSA, or faxing it in. You cannot do Part B enrollment after 65 over the phone. Again, Part A and B is something that you need to take very seriously if you're turning 65 and having no other benefits and not enrolled in Social Security. They will not send you a notification in the mail. I did go over briefly the differences of original Medicare and Medicare Advantage. If you're working past 65, check with your employer to make sure your coverage is that magic word, creditable. Don't be afraid to ask questions, whether you're working with an independent professional like ourselves, your HR department, someone else, your doctors, your providers, your pharmacists. Ask questions. Do not be afraid. Medicare will oftentimes be different than your existing health insurance, and it's important that you understand where those differences are. Medicare can be confusing and frustrating. We always recommend with those penalties to start early. You can never be too early with Medicare. You can definitely be late and pay for it, but starting early is a good thing. If you are, say, today going to apply for Medicare to start on January 1st, understand your first payment for Medicare Part B wouldn't be due till December 26th. So don't be afraid that bills are going to come into you ahead of that. Medicare can only bill you when you're actually enrolled in the plan and going to start those benefits. Again, Medicare is an individual decision. No matter whether you're married or single, it's your decision. Again, select the policies that are best for you. Again, for compliance reasons, we can't do a comparison of actual plans here, but should you need assistance in understanding your local plan options, please reach out to us. Again, select a plan that meets your medical needs first. I mean, this is just 32 years in the insurance business. Our health is paramount. Make sure that you address the benefits that will provide access to your providers and at the lowest cost possible, but access being vital. And that's not just medical providers, but pharmaceutical benefits as well. Do your own research. There's no question that knowledge is power in everything, but especially in Medicare. Call your doctors to confirm if they accept Medicare. Work with your local pharmacy to make sure that your medications would be covered by those plans. There are a lot of moving parts in Medicare, so asking those questions and doing your own research will also help. There are some resources that you can use to help you. So SSA.gov is really just the enrollment tool. There's not much there on Medicare. However, Medicare.gov is obviously the government open access to the public. All aspects of Medicare are covered there. MyMedicare.gov is a website that once you're enrolled in Medicare is very, very beneficial. This will be just like your bank account or any other account you have. This will be all your information pertaining to your Medicare benefits. We highly encourage you to enroll in that and be an active visitor to that website for your information. You can track claims, print your ID cards, get updates on various aspects of Medicare. It's a very robust website, and it's only becoming better and better for those on Medicare. There's an app if you have a smartphone called Medicare What's Covered. It's free. What's important there is that you can actually track what services are covered by Medicare. It's important to note if Medicare covers it, your Medicare Advantage plan will cover it. The difference will be how you pay for it. The Medicare What's Covered app will typically show you that it's covered under Part A or Part B, and under Part B, you may pay 20%. But understand if you have a Medigap, it would address that. This is just the government telling you what services are covered. Our website, MEDICAREPORTAL.org, is an educational website. We've tried to combine a lot of the information that's out there and simplify it for you as a one-stop shop for your Medicare resources. The federal government has resources like a Medicare and You book. Many of you may have gotten that every year in the mail. If you're turning 65, it'll typically show up 3 months prior to that. And then there's also another book called Choosing a Medigap Plan. That book will help you understand Medigap, which is that secondary payer, Medicare supplement, and that will help you understand how those programs work, how to shop for those. So these are just some of the resources that we know are available to you as a Medicare eligible or Medicare current enrollee. Now, Susan, I'll stop there for a second. I can address the donut hole now. I did it this way because if people weren't interested in it, I didn't want to keep them on any longer than they needed to be.
Great.
I can answer that. And then if other questions come in, I'll address those during this open forum here. So I'll start with the donut hole. So under Part D, and just as an aside, if you go to our website, we actually have what we call our micro learning educational event. It's a 15-minute webinar hosted by myself or one of my associates, and we go into detail about Part D. Again, it's not a sales event, it's an educational event, so you will understand how Part D works, because it is without question the most complex and complicated aspect of Medicare. So I'll try to do it as quickly as I can and answer the question, but understand it is a very lengthy conversation to truly understand all aspects of Part D. So Part D is the same no matter whether you get it through a Plan C or a standalone Part D. The program design is exactly the same. And what I mean by that is you have 4 stages of each plan. You can have a deductible, what's called the initial coverage level. You can have the coverage gap or donut hole, and then you get into what's called catastrophic. Every plan, whether you get your benefits through C or standalone D, have those 4 phases. Now, some plans may not have a deductible, or they can reduce the deductible. For this year, the maximum deductible is $435. However, you could enroll in a plan that has a 0 deductible or $100. Again, that is your decision. To address your question specifically about the coverage gap or donut hole, in 2006, when the Part D was first passed, Medicare beneficiaries were responsible for 100% of your drug costs while in this coverage gap. Today, through legislative changes, that number is down to 25%. So what happens is when you're spending, meaning what you pay for drugs and your insurance company and potentially the pharmaceutical companies pay towards your drug costs in a calendar year. So for this year, when they reach $4,020, every dollar after that, you would be responsible for 25% while in that coverage gap. And you would remain in that coverage gap till $6,320. So you would continue to pay 25% of those medications while in that coverage gap. When you reach that spending limit, or what we call TROOP, your true out of pocket at $6,320, from that point beyond, you get into what's called catastrophic, where instead of paying 25%, you would pay 5% or a copay, whichever is greater. So there is some, quote, relief on the back end after your spending goes through the donut hole or coverage gap. But the coverage gap, you are responsible for 25% of all claims of those medications in there. Now, oftentimes there's what's called 5 tiers. All plans have a 5-tier program. Tier 1 are going to be preferred generics. Tier 2 will be your generics along with some brand name drugs. Tier 3 will be brand name drugs. And tiers 4 and 5 are the expensive, what we call specialty medications. Oftentimes in the donut hole, you can find a program that will remain your copays at a low level for your generics. They may waive those generic, well, they not waive, they may not charge the 25%. you have to study your plans to find out which plan will provide the right benefits to you in the donut hole. There are approximately somewhere in the high 20s to 30 eligible standalone prescription drug plans in Fairfax County, for example. So doing your research every year to make sure your plan will keep your costs at the lowest is an important process. And now during the open enrollment period is when you should do that, because should you miss this, you can't make that change till next annual enrollment for your Part D. If you are receiving your benefits through a Plan C Medicare Advantage, you do get a second opportunity to change during what's called the open enrollment period starting in January. But the donut hole, to kind of close a loop on that, is something, the coverage gap that has changed. Do we hope that someday it's non-existent? Well, of course, but the overwhelming majority of Medicare beneficiaries will avoid that. Staying on generics obviously will keep you out of those donut holes and coverage gaps, but understand sometimes we don't have a choice in our health or our Medicare, how we receive the prescription drugs. So doing your best to keep those costs down and identifying a plan that works for you would be my recommendation. Anything else, Susan?
No, John, that was excellent. I don't have any other questions for you.
Well, I just want to close and say thank you to you, your staff, your associates, for everybody taking their time today to spend it with us. Again, if they ever have any questions, we're here local. Our office is in Tyson's Corner, although, it's hard to meet with people in these circumstances. We have full capabilities for virtual Zooms, Google Meetups and all that, as well as obviously telephonic and electronic commerce through email should they have any questions. They just want a quick answer through email.
Great. Well, thank you again, John. This was wonderful. And again, we're going to do a rebroadcast of this on both the Falls Church, Kensington, and the Reston Kensington websites.